The Refractory IBS service is a dietetic-led service here at the Secondary Care Trust, supported by a consultant gastroenterologist. We provide dietetic interventions to help manage difficult to manage irritable bowel symptoms through the form of predominantly a low FODMAP diet, which is a diet low in fermentable carbohydrate that's been shown in research to be incredibly effective in managing IBS symptoms. However, it is quite challenging, so requires the intensive support of dietetic services. For those patients who don't benefit from that diet, as I say, we have the gastroenterologist support and we liaise very closely and work together in terms of managing these patients and providing further investigation if that's needed.
IBS can be really complicated to manage, and patients have really horrible symptoms sometimes, which can range from very profuse diarrhoea to bloating, abdominal discomfort, sometimes constipation predominant symptoms. And the symptoms can come and go. They can be exacerbated with food types, exacerbated by anxiety. And some people's lives are really quite blighted by some of these symptoms. And there's also this underlying level of concern that maybe there's something more sinister going on.
I went to see this lady who saw me for about an hour and told me all about the FODMAP, which is a plan to pinpoint what is not agreeing with your bowels. Because this is where I had pains for over 15 years.
The results have been marvellous. It's completely changed her life. The pains have gone. The process was very straightforward and logical and easy to follow, and it required no medication.
I literally ate what I was allowed, and all the pains disappeared. Everything disappeared.
There are long-established Rome criteria for diagnosis of IBS, and they form part of the pathway we've put together for GPs to refer to, alongside a full algorithm of what to test for, what to rule out before a confirmed diagnosis of IBS is made. Once that's made, then the pathway of care we've put into place for GPs can help to manage those symptoms in a first-line way. If those first-line management strategies don't work, it's at that point that a referral to the Refractory IBS service could be put in place.
If a GP is happy that this is irritable bowel syndrome, then we now have less invasive ways of investigating them, and one of those things is fecal calprotectin. And that's a biomarker of inflammation in the bowel. So what we can do now, rather than do a scope, we can now take a simple stool test. We can analyse that very rapidly within the trust. If it's less than 150, as a sort of arbitrary line that's been drawn, if it's less than 150, then the GPs are happy that there is no inflammatory process driving the symptoms, and they can refer them to Clare if they've failed other forms of treatment for IBS. It is more cost effective to refer to Clare and to the dietetic team for the treatment of difficult to manage IBS than it is to refer to somebody like me.
It's important that patients get referred to the service at the right time, because not all patients will need the services of the Refractory IBS service. A good proportion of patients with irritable bowel syndrome can be managed in primary care. There'll only be a small subset of patients with IBS whose condition symptoms are particularly complex and difficult to manage, that additional input from the Refractory IBS service would be indicated. So it's very important that GPs work through the pathway of care, trial all the first-line interventions that we've suggested before referring to the Refractory IBS service.
Well, before I used to be afraid all day. I'm going to have the pain, I'm going to have the pain. Now I know I'm not going to have the pain.
What is great is it requires no medication, or it's just something that's biologically controlling your diet and your food intake. You can monitor what foods are giving you problems.
The reason the FODMAP works so well is because rather than be a diet that you're giving somebody for life, because that's not what this is about. This is about empowering patients and giving them the structure that they need to try and control their symptoms and manage them appropriately. They're not allergic to these foods. We don't tell people they can never have bread again or never have these high FODMAP containing carbohydrates. What we do is we try and give them the armour they need, if you like, to protect them from their symptoms if and when they flare. And many patients feel quite empowered and quite in control of their symptoms because of that. And then hopefully you end up with a patient who feels in control of their IBS rather than their IBS controlling them.